This was submitted a couple weeks ago regarding Adequan, since we talked about it a little bit tonight. Regarding the protocol, say an animal went without a month receiving an injection, is it necessary to restart the protocol? Can you talk a little bit about that?
Yes, so that is a really interesting question because the company only has data for 2 injections a week for 4 weeks. So that's really the ramp up protocol. And that from their perspective, you do that, patient gets comfortable. When they become uncomfortable, you just repeat that. As a pain management guy and one who wants to try to keep our patients consistently comfortable without them proving that they need another injection, my off-label approach to Adequan is if a patient has responded well to 2 injections a week for 4 weeks, and that 4 weeks is important because a lot of patients don't respond until at least the third week. If they've responded, then I have a very systematic decrease in frequency approach with a caveat at the end. Once a week for 4 weeks, followed by every other week for 4 doses. So that's 8 weeks. Now we're out a total of 12 weeks, then every 3 weeks and every 4 weeks. With the caveat that as you're trying to spread this out, if the patient becomes more painful because we've gone too long, just give the injection, subtract 2 days. I know this sounds complicated. Subtract 2 days, and that becomes in the frequency protocol. So if you're trying to get out to 3 weeks, patient seems to regress at 19 days, give the injection, and then give it every 17 days so that your patient, your pet, doesn't need to prove that he or she is painful. Every time they have to prove that they're painful, we risk maladaptive pain.